Thank you, Chair. We welcome this bill, which is a very long overdue piece of legislation to provide the legal basis for the development and deployment of digital health records, amongst other things. Mr Donnelly, you yourself have admitted that we have lagged significantly behind the rest of Europe on this, and the reality is that our people have not been getting the best care that they could due to the paper-based nature of our health records. We live in a world where technology is rapidly transforming our day-to-day lives, yet in our healthcare system, digital innovation has continued to elude us. What this bill can provide is the legal basis for a more efficient, safe and patient-centred healthcare system. One of the most important things that digital health records will provide for is a better continuity of care, particularly for people suffering long-term illnesses. I myself have just assisted a constituent through a process of complaint with an acute hospital that was based on a misreading of the paper-based record, and a very large paper-based record. Luckily, the issue didn't have serious illness impacts or worse, but it could have. It is very, very minor, but the amount of administration it took up with a very genuine complaint, these are the kind of things that could be avoided. This could be genuinely transformative, and should be genuinely transformative for our health system if we deliver a proper electronic health-based system. It could genuinely save lives. This will not just be something that will improve administration. It will have very tangible health benefits for individuals. Digital health records will be vital to drive efficiency across our health service. With waiting lists as long as they are, anything that can be done and provided to our medical staff to make their job easier and quicker needs to be prioritised, which is why we welcome this bill, but we're so disappointed it is long overdue. We know from examples across Europe that digital health records do exactly that, so we need to see this, and indeed the next government at this stage, deliver upon the digital health records. There is an opportunity here for our healthcare staff to feel like they are being listened to by government that they feel that they've been sorely missing for a number of years now. The upside of digital health records being introduced in the Irish context cannot be understated, and as I said, this can be a real game changer for our health service. We cannot afford to stay in the last century vis-à-vis our medical records. Ask anyone who works in our health service the sheer amount of paperwork that they have to complete. Literal paperwork with pen and paper is absolutely overwhelming. It's a complete drain on limited resources and on specialist resources that we have in our health service, who should be bedside or patient-facing as much as possible, with a minimum being spent at the desk. The reality is the introduction of digital health records is not just important for patients, but as I said, it is equally important for staff members and improving the work-life balance, or the work balance of our healthcare workers. We know we have a problem with retention within our health service. A lot of that is down to pressure that our workers feel on a daily basis, and one of the key integral pressures that we hear back speaking to workers and speaking to their representatives is the amount of non-patient facing related work that they have to do. Year after year, the jobs of our healthcare staff get harder and harder instead of being made easier and more efficient. There's a responsibility on all of us in this chamber to do everything we can to help them, and ensuring that once this bill is passed as an enabling piece of legislation, that we actually deliver on what it sets out to do. In my position as health spokesman for the Labour Party, I've made it abundantly clear that I feel, and we feel, the government has thrown in the towel on fixing the health system. The fraudulent budget of 2024 and the subsequent ongoing recruitment embargo, which still does exist in reality, even though the government said they have lifted it, are still wreaking untold damage upon the staff and health services across the country. And whilst this is welcome as an enabling piece of legislation, we are still a long way away from having the real efficiencies and health benefits being delivered to our patients that digital health records can do. Constant delays are unfortunately a theme of this government in relation to the health service and the delivery of big projects. We of course are continue dealing this week again with the omni-shambles that has been the Children's Hospital. But in 2016, a 10-year business plan for the implementation of a national EHR system estimated that would amount to up to €875 million. Now, that was in 2016. We were nearly a decade on, and nothing is the same price as it was 8 years ago. And we don't know the costs of how much a digital health system will deliver or will be, but we have to bring it in, and we have to ensure that this does not become another runaway train of health spending. It needs to be delivered. It needs to be delivered professionally. It needs to be delivered responsibly, and it needs to be delivered in a way that has real financial accountability. In 2021, HICWA highlighted what they said was major deficiencies in the current information system, with data on patient health usually being managed on different electronic systems or on paper-based systems, affecting people's health and their safety within our health service. I've seen the real-term effects of how far behind we are. I had another young man in my advice clinic last year. Unbeknownst to him, the reason he was not getting the care he needed was due to a missing paper file. Now, this was a serious health issue at the time, which luckily we were able to catch in relation to that young man, but he was not receiving the care because of a missing file. It's absolutely embarrassing in this day and age, indeed in any day and age, for any health service. Serious questions need to be and should be asked about how the implementation of DHR has been delayed thus far. In January 2023, the HSE's then Head of Digital Transformation, Professor Martin Curley, resigned from his post, saying his efforts to introduce new technology solutions were repeatedly blocked by senior administrators. Minister, I need to ask you, and I hope in your summing up, is this still a concern for you? Are these blockages still going to be in place? January 2023 is not that long ago, and it is unacceptable that there should be any blockages by any senior officials within the HSE towards this much needed transformation. As it stands, our healthcare system is disjointed and fragmented. We've spoken on this before, and there are a huge issue around siloed care that has impacts throughout our health service and equals poorer care. A modern healthcare system needs to be agile, and information needs to be shared and flow freely between our healthcare providers, be it GPs, doctors, nurses, consultants or specialists. We do have situations where public patients are referred to private hospitals for MRIs or such like. Will this system ensure that those records are going to be shared between a private hospital and a public hospital? These are the questions that we need to see answered and need to be confident that they are going to be delivered upon. The duty to share places a statutory duty on health service providers to share personal health data with other health service providers for the purpose of patient care and treatment. It's comprehensive, as I said, in that it spans public, the private use and voluntary settings, and is vital for the continuity of care and for an integrated health system that is envisaged in Sláinte Care. We know now, leaving out any surplus we already have for budget 2025, that there is a €14 billion in play following the conclusion of the Apple tax case. We, of course, need to see the large majority of this invested in housing and infrastructure. But if money is going to be allocated to health in this, and there are many, many areas of health which do need direct funding and assistance, if digital health records are going to be delivered and are going to be delivered as quick as possible, then I do believe it is an important project that could benefit from extra funding at this point in order to ensure that it gets off to the best possible start and is implemented as early and as professionally as possible. There's no doubt in my mind, Minister, that digital health records is a key missing pillar of our health service. It will, if delivered, help our frontline healthcare professionals provide better healthcare and be patient-facing more often. We need to prioritise it, and I'm glad that this enabling piece of legislation has finally come to the floor of the Dáil, and I hope to see it pass soon. But the real proof in the pudding will be the implementation and delivery of EHR themselves. Thank you, Councillor Corlett.